Why is interstitial cystitis diagnosis so challenging? Imagine trying to solve a puzzle where some pieces are missing and others look alike. That's often what diagnosing interstitial cystitis, also called bladder pain syndrome, feels like. It's a complex condition that causes bladder pain, pressure, and a frequent urge to urinate, but pinpointing it isn't straightforward. One reason is that there's no single test that confirms interstitial cystitis. Unlike urinary tract infections, which can be identified with a simple urine culture, or bladder cancer, which can be seen through imaging scans or biopsies, interstitial cystitis relies on ruling out other conditions. Doctors perform a process called diagnosis of exclusion, where they first eliminate other issues like infections, overactive bladder, or even bladder cancer. This is important because many of these conditions share symptoms such as frequent urination or pelvic discomfort. Another challenge is that symptoms can vary widely from person to person. Some people experience intense pain and urgent needs to urinate, while others have milder or intermittent symptoms. This variability makes it difficult to set clear, universal criteria for diagnosis. The criteria used in research studies are often too strict for everyday practice, which means many people with genuine symptoms might not meet those standards. Overlap with other pelvic and bladder issues adds to the confusion. For example, overactive bladder causes urgency and frequency, but usually without pain, which is a key feature of interstitial cystitis. Bladder cancer can also cause similar urinary symptoms, especially in those with risk factors or unusual presentations. Conditions like chronic prostatitis in men or endometriosis in women can mimic interstitial cystitis, making it even harder to distinguish between them. The underlying causes of interstitial cystitis are still not fully understood. Researchers believe issues like a damaged bladder lining, inflammation, or nerve signaling problems might play a role, but these mechanisms can differ among individuals. Because of this, there is no one-size-fits-all treatment, and doctors don't have a simple test to confirm the diagnosis or track how well treatments are working. The symptoms themselves are subjective. What feels like severe pain to one person might be mild to another, and they can fluctuate over time. This makes it easy to overlook or delay diagnosis, especially if patients don't report their symptoms clearly or if healthcare providers aren't familiar with the condition. It's important to note that while interstitial cystitis can be very uncomfortable and impact quality of life, it is not a form of cancer and does not increase the risk of bladder cancer. Still, because some symptoms overlap, doctors need to carefully evaluate to rule out other serious conditions. Maintaining good bladder health involves staying well hydrated, avoiding bladder irritants like caffeine and alcohol, and seeking medical advice if symptoms persist or worsen. In summary, diagnosing interstitial cystitis is challenging because there's no definitive test, symptoms overlap with many other conditions, the causes are not fully understood, and individual experiences vary widely. Accurate diagnosis depends on thorough evaluation, ruling out other issues, and listening carefully to what the patient reports. Often, a team approach involving urologists, gynecologists, and pain specialists is needed. If you're experiencing ongoing bladder symptoms, it's essential to consult a healthcare professional for personalized assessment and care.